Today we are going to talk about pustular psoriasis. Pustular psoriasis have multiple variants. First is generalized pustular psoriasis. Clinical variants based on morphology and natural history. First is acute generalized pustular psoriasis of von Zumbisch, and second type of generalized pustular psoriasis is subacute annular and succinate pustular psoriasis. Other specified forms based on age and precipitants include acute generalized pustular psoriasis of pregnancy, also called impetigo herpetiformis, and second is infantile and juvenile generalized pustular psoriasis. Localized pustular psoriasis have further two types, palmoplantar pustulosis and acrodermatitis continua of Halopio. Today we will briefly talk about generalized pustular psoriasis, its clinical features, introduction, pathogenesis, and management. It is acute, subacute, or chronic eruption. Generalized sterile pustulosis, and it is rare form, and all features of disease are accentuated. Incidence is 0.64 and 1.76 per million. Age of onset is 40 to 59 years, and it is generally greater incidence in female than males. Associated disease include inflammatory polyarthritis, metabolic syndromes like obesity, hypertension, diabetes mellitus, and dyslipidemias. Pathophysiology. First of all, predisposing factors for flares of generalized pustular psoriasis include infection, most likely upper respiratory tract infections, topical and systemic treatments, psychological stress, pregnancy, hypocalcemia, coal tar, irritating topical therapy. Histopathology. On biopsy of the skin of the lesions, histopathology shows superficial subcorneal pustules and neutrophilic infiltration. Kugoj spongiform pustules are a distinct histopathological feature. Next are parakeratosis, acanthosis, hyperkeratosis, elongated rete ridges, reduced stratum granulosum, and capillary dilation of the papillary dermis. And last are the Monroe's microabscess formation. Genetic and environmental risk factors include family history of plaque psoriasis and family history of generalized pustular psoriasis, deleterious germline mutation in IL36RN gene. IL36RN encodes the IL36 receptor antagonist and is antagonist of pro-inflammatory cytokines of interleukin 1 family, which activates signal pathways NF-κB and mitogen activated protein MAP kinase and are interregulated by helper T17 cytokines and TNF alpha. Abnormal interleukin 36 signaling is also involved. Pathophysiology involves abnormal interleukin 36 signaling has an important role in the establishment of cutaneous inflammation. Mutation in CARD14 in plaque psoriasis is identified, and AP1S3 adaptor-related protein complex 1 subunit sigma 3 and MPO myeloperoxidase and serpin peptidase inhibitor clade A membrane 3.